Welcome to the National Kidney Foundation's The Big Ask, The Big Give program. I am Kathleen Davis, Executive Director for the National Kidney Foundation, serving Eastern Missouri, Metro East, and Arkansas. I'm so happy that you are joining us today and hopeful that you will leave with tools to help you along your kidney health journey. The purpose of this program is to provide education about donation and transplant and help you share your story to find a living donor. All audience members are muted, but you can unmute yourself or use the Q&A feature to ask questions. We also want you to use the chat box to comment and participate throughout the program. This event will be recorded so you can view anything you missed or review information for a second time. We'll send out the link to the recording in our follow-up email. You should have received a packet of handouts in advance via email. This packet contains handouts that will reference throughout the event. If you did not receive this or you would like to download another copy, we've shared a link in the chat for you. We're here today because there is an urgent need for kidneys and the waiting list for the transplant is long. This program aims to help more people find a living donor and reduce that wait time. You probably already know that there are two treatments for kidney failure: dialysis or transplant. In general, a living donation is the best and healthiest option for patients who have kidney failure. But kidney patients, family members, and friends often don't know enough about living donation. Even when you do, you may be shy about asking someone to consider living donation. You may not know who to ask, and you may not even need to ask. Just by sharing your story, there is a good chance that a living donor will come forward. Today, we will share strategies that can be used by kidney patients along with their family members and friends who want to spread the word about your need. Family friends will learn how to be an effective advocate for the kidney patient. If you are a family member or friend, be sure to ask the patient's permission to use the strategies here. Please do not share their story or personal information without their permission. A little about the program. The National Kidney Foundation developed this program in partnership with transplant centers, kidney patients, health professionals, and other living donors. The ideas shared today are all ideas that patients and families have said work for them. Thank you.
Good afternoon. My name is Megan Schultz, and I am the Program Manager for the National Kidney Foundation serving Eastern Missouri. Thank you for taking the time today to increase your knowledge of key steps towards living donation. This program can truly help you find a living kidney donor. Today, we're going to teach you 7 key strategies to find a living donor. We'll start with busting some myths about kidney donation, and then we'll share some facts about kidney donation so you can feel prepared to have a conversation with someone when they ask about kidney donation. Then we're going to talk in depth about all the different tools and resources you can use to find a living donor. We'll teach you how to create your story, spread the word, and build a network of advocates to help you. We'll hear from living donors and transplant recipients about their experiences. Then we'll talk about ways to start a conversation with someone about the possibility of them donating a kidney to you. You'll then finalize your own personalized action plan of next steps that you plan to take. We will close with the Q&A portion to ask our presenters any questions. We'll walk you through everything you need to know so you leave today with really specific tools and plans that work for you. Who is ready to get started? Before we go further, I just wanted to thank our sponsor who made this program possible today, SSM Health St. Louis University Hospital. Our clinical team today includes Dr. Lentine, a nephrologist and medical director of Living Donation, Dr. Varma, a senior transplant and living donor surgeon, Dr. Fleetwood, a transplant and living donor surgeon, and Cody Woolley, living donor coordinator at the Transplant Center. And with that, I am now going to hand it over to Dr. Lentine.
Hello, everyone. Thank you so much for joining us. It's important for you to understand what living donation is all about, but it's equally important that people with whom you share your story have facts on living donation so that they can make informed decisions when they consider if donation is right for them. We'd like to illustrate some key concepts in the form of a quiz. Let's see how well you can pick out myths or statements that are untrue, and then we'll review the facts. And the goal is that you'll feel more comfortable and prepared to share facts when talking with others. So most of you are here today because you or someone you love needs a kidney transplant. You probably already know some information about living donation and transplant, but we'll start with some quick reminders. And these facts may be helpful to know when talking with others about kidney donation. So, there are two treatments for kidney failure: dialysis and transplantation. Briefly, dialysis uses a machine to do the kidney's job of cleaning the blood and removing waste products. For many people, a transplant is the preferred option because it does a better job of restoring patients to health. Transplantation offers more freedom and a better quality of life than dialysis. And a transplant can come from either a living donor or a deceased donor. So let's start by reflecting on some true false questions to see what you already know. So, true or false, kidneys from living donors typically last longer than from deceased donors. And number two, you can get a kidney transplant before you have to start dialysis. So, great job. Both types of transplant are very good, but there are some additional benefits of a transplant from a living donor. For the kidney patient, there are many advantages to living donor transplant. Waiting time on dialysis is reduced, or you may even be able to avoid dialysis altogether. Importantly, kidneys from living donors typically work better and last longer. A kidney from a deceased donor lasts an average of 7 years, whereas a kidney from a living donor lasts an average of 15 to 20 years. If you receive a living donor kidney, it will generally start working almost immediately, whereas sometimes a deceased donor kidney may take some time to start working. All of this leads to quality of life benefits due to having a well functioning organ. Another advantage is that you don't need to wait for a deceased donor organ. If you start the transplant evaluation process early, it is possible to get a kidney transplant from a living donor before you ever have to start dialysis. And this is called a preemptive transplant. Another benefit from living donation is that it helps others on the waiting list. If someone can get a transplant from a living donor, that removes them from the waiting list, which then shortens the waiting time for others. So, now a few more statements, and these are about long term effects of donation on the donor. So, true or false, kidney donors have to take medicine for the rest of their lives. A kidney donor will have to change their diet after donation. A kidney donor can no longer play sports or exercise. A kidney donor can't drink alcohol after donation. A female donor can get pregnant after donation. Great job. Most of you knew that kidney donors do not have to take any special medicines after donation. A kidney donor will only need to take pain medicine and stool softeners for a short time after surgery. After that time, a donor doesn't have to take any medicine related to donation. There are no dietary restrictions after donation. A kidney donor can eat anything, but like everyone, should follow a healthy, well balanced diet. A kidney donor should be able to return to regular activities, including sports and exercise, and return to baseline activity by about 4 to 6 weeks after surgery. A kidney donor can drink alcohol in moderation, but that said, drinking too much alcohol is dangerous for anyone, and there is a greater risk for complications of dehydration when living with one kidney. Women can conceive after donation, and there is no impact on fertility, although we advise waiting about a year after donation to become pregnant. The body needs time to recover from the surgery and to adjust to living with one kidney before pregnancy. So, as you can see, living kidney donors lead normal, healthy lives. Quality of life is typically equal to that of the average healthy adult. And importantly, evaluation for donation includes a complete physical examination and very careful testing to ensure that donation is safe for the individual. The costs of the evaluation are paid by the recipient's insurance or Medicare, and follow up care is provided. And all of these measures are part of the process to ensure that the donation process is safe for the individual. So, all right, one last set of questions for now regarding who can be a kidney donor. So, true or false, a kidney donor can't be older than age 60. A kidney donor must be about the same age as their recipient. And a kidney donor doesn't need to be the same blood type as the recipient. So, excellent job. As most of you noted, living kidney donors do not have to be young people. A healthy person over the age of 60 can be a living donor and have no problems from surgery and donation. A kidney from an older donor can work very well. A donor does have to be at least 18 years old, and the evaluation will determine if a candidate is suitable to be a donor given health and psychosocial considerations. We also recognize that donors and recipients do not need to be the same age. And research has shown that transplants can work very well when there's an age difference between the donor and the recipient. A donor's blood type may be different than the recipient's, but still may be considered compatible. For example, a person with type A blood can donate directly to a person with type AB blood. A person with type O blood is a universal donor, being there are not blood type barriers to their donation. And the key concern is that the donor and recipient's blood types are compatible so that the recipient's body will not react to antigens on the donated organ. But even if incompatible, there's opportunity to participate in what's called kidney exchange. Anyone who is interested in donation should contact the living donor team. Allow the transplant team to decide if a potential donor is eligible and go through the assessment with the individual. An important strategy to be aware of is kidney paired donation. We mentioned biological compatibility, the key elements of which are compatible blood types that we mentioned, and also what's called a negative cross-match, meaning the recipient does not have preformed antibodies to the donor's tissue. If a healthy, willing donor is not biologically compatible with their intended recipient, they can still help make the transplant happen by participating in an exchange. Exchange programs use matching algorithms to create compatible donor-recipient combinations. And there are a variety of swaps that can occur, including two-way and three-way. Chains can be formed, including when a non-directed donor or someone who wishes to donate but does not have an identified recipient donates to start a chain. And this innovation has had a remarkable impact in breaking down barriers and allowing more transplants to happen. So thank you for your attention, and we'll move on in the program.
So let's see if you can identify whether a few more things are true or false. These statements are about the donation surgery, the surgery for the person who is donating the kidney to someone in need of a transplant. True or false? A kidney donor is usually in pain for about 3 to 4 months after surgery. And number 2, true or false? A kidney donor will usually be in the hospital for about 1 to 2 nights after surgery. Excellent job. Most living donors have laparoscopic surgery. It is the standard of care. Laparoscopic surgery typically means smaller incisions, faster recovery, and less pain. The usual hospital stay is 1 to 2 nights. With respect to the actual incisions themselves, they are closed with absorbable sutures, and on top of the incision, we put something known as Dermabond, which is a type of glue, and that usually washes off in several days. The donor is encouraged to start walking the day after surgery, and a full recovery takes place about 4 to 6 weeks later, although most patients start returning to many normal activities after about a week or so. Returning to the work is usually approved in about 2 weeks. During our panel, some donors will share directly about their experiences. A kidney donor will have some pain after surgery from the incisions and from gas and bloating, and this pain will decrease in the days after surgery, and they can be usually controlled with Tylenol and pain medicine if needed. The pain medicine is generally only needed for about 1 to 2 weeks after donating. Time on pain medicine is decided between the donor and the transplant team. Many transplant centers are now using pain blocks, which are administered to help decrease the pain during recovery and minimize the use of pain medicine. There are no dietary restrictions following donation, but a healthy, balanced diet is recommended. The post-donation follow-up is usually in 7 days or a week. Short-term risks are those of a surgical procedure. There is early post-operative pain. With smaller incisions and a less invasive approach, long-term pain is rare, but we do emphasize to our donor candidates that having an operation does hurt. In fact, if you take a picture of the donor and the recipient after surgery, the one who is not smiling in the picture is the donor. Donors are healthy people. Some have never undergone surgery. We want them to try to prepare. You can hear more from our panel, but that said, some don't fill the pain medications they are given at discharge and transition to Tylenol. Urinary tract infections are very rare. Bleeding could occur when we disconnect the artery and the vein of the donor kidney, but this is rare. Blood clots, due to being paralyzed on the table for 3 to 4 hours with the calf muscles not working, we do put on calf pumps. We also give subcutaneous heparin while you're in the hospital. If a female donor is on oral contraceptive medications, we ask them to stop it a few weeks before, as the risk of blood clots is increased. Rarely there can be an allergic reaction to anesthesia. With respect to the death rate, it is extremely low, quoted as 0.03% within 3 months of the donation, which equates to about 3 in every 10,000 people who donate. In that window, some of the causes for a death rate, which is included, are accidents and trauma.
So we've just learned about the first 2 of 7 strategies: bust myths and know the facts. In order to find a living donor, you first have to tell people that you need a kidney. You might be wondering, how do you spread the word? How will that help you find a living donor? The first step is to figure out what you will say. We call this your kidney story. The first step is to create that story. In this section, we're going to talk about strategy number 3 to create your story.
Now we're going to hear from Daryl. He's here with his donor, Tanya, and they are transplant donor and recipient from SSM Health St. Louis University Hospital. Daryl's going to tell us about his experience creating his story to find a living donor. We're going to have some time for Q&A with Daryl and Tanya, as well as other recipients and kidney donors at the end of the webinar. But feel free to start submitting questions at this time in the chat. So Daryl, can you tell us a little bit about yourself?
Sure. My name is Daryl. Currently, I live in Southern Illinois on the Illinois side. I'm a high school basketball coach. I'm the stop coordinator at CEO Academy in Troy, Illinois. And I also run a side business, DJing.
That's fantastic. Can you tell us a little bit about your connection to kidney disease?
Sure. I had kidney disease at an early age. It wasn't always detected as an early age, but I was always told that there was too much protein in my urine. I was on an athletic scholarship, full scholarship at Kansas State University, and It was too much urine in my protein, and I think they had already detected that I could have problems down the road, down the line. And basically, what I was told was just eat in moderation with certain things, but I wasn't aware how to take care of the solution to my kidney disease. As I became older, obviously the problem kind of worsened. For a lot of years, it stayed real steady. I did good. I changed my diet. But most recently here, my progress digressed and I had to have a kidney transplant. I wish I would have known earlier more preventive things to do with diet, plant-based and things like that, because my kidney function did improve, although it went back down, which we all know that that's a different situation. But preventative maintenance is always a positive.
Tanya, can you tell us about how you heard about his kidney disease?
Sure. Thank you, Cody. And thanks, Daryl, because listening to you kind of takes me back to the question that Cody's even asking. We always knew that Daryl had this, but as he indicated, there were other things that were happening to him in his late teens. And so as a family, we were kids, right? So we had no idea. We just knew that Daryl had something, as teenagers, but he always continued to perform in school as well as athletically. So I just kind of remember, I feel like, there was kind of like incidents, right? And then he'd get back on his feet, right? So something would happen and he'd be back at it again. By the time we got to our 20s, I was married with kids, and Daryl was traveling with his career. And so you don't hear the everyday stories, but if something were to happen, it always ended like he's back, but he's better. As we got a little older, our kids got older and maybe we were a little bit closer and more in touch with everybody's day-to-day life. It seemed like the incidents were getting closer together. There seemed like there were more instances of, well, Daryl's in the hospital, or Daryl had to, get some treatment over a couple of days. So from my perspective, as a family member, I didn't quite understand, like, why wasn't he like permanently better? Like, what was it that was happening? Because he'd say, well, I'm doing this or I'm doing that. I'm following up with the doctors, but that's how oftentimes when we talk about health justice, right? That's oftentimes how the practitioner and the client are set up and the patient are set up in relationship with each other. The practitioner has all the knowledge. And so if you're still sick, it's because the patient is not doing something. And I think what we've learned recently in these last 2 years is that couldn't have been farther from the case. I think the information that we as a family have benefited from in the last 2 years should have been told to us decades ago. And we probably would have had a much different outlook. Thank God that not only does Daryl take charge of his own healthcare and function as his best advocate, but he has a plethora of others who also fight for him when he's not able to do so for himself. So it makes you wonder for the patients that don't have, one, a good enough understanding of what actually is happening to their body while it's happening, don't have the support to take those preventative measures, and 3, don't have enough of a support system around them to kind of prop them up when they are, at their lowest, or when they're struggling to try to understand what's going on. How many thousands of people are those? And especially when you zone in, particularly in the Black community, where we know that as Black Americans, we are 4 times as likely to develop chronic kidney disease as whites are.
I think it's really wonderful that you stepped up to the plate. Do you remember when you first started to think about being a donor?
Oh, absolutely. So in high school, as a donor of, doing the blood drives when you're in high school, I learned, one, that I was O negative. So I learned I had special blood that could help a lot of people. And so that was one kind of like my big toe dipping into the pool of the importance of not only donating blood, but organ tissue donation. So very early on, I knew that, there were people that could benefit while you were alive as well as after.
So did Daryl ask you to be his donor?
No. And we later learned that Daryl actually had no idea until actually I was down meeting with you, Cody, and it was revealed to Daryl. So when we learned that Daryl had contracted COVID and his COVID exacerbated his kidney disease. With the exacerbation of his kidney disease, he had to go on dialysis. It was then that, I'm not exactly sure how many family members were made aware, but that Daryl's situation was getting progressively worse rapidly. It was the, crying phone call of his sister. So she learned that she was not going to be able to be a match for a kidney donation.
Once I got to meet the St. Louis University, some of the team members and some of the things I was going through, and I needed a medication and you were pulling strings and helping, it made things so much easier. It starts to make you feel more comfortable and feeling much better about the situation. Like, is this just a business and they're trying to get money?
I had no idea that there was an eligibility process, not only for myself, but for him. So
Right.
I'm not even talking about being on a list. I think we all know what that list looks like. But there's a doctor and a team that has to even say that he would benefit from the kidney transplant, which I just thought, well, if he's sick and he needs one, then of course he's eligible. But that's not the case. And so how many people really know about that?
My transplant has been absolutely, it's been wonderful. It's been life-changing for me in a lot of ways. It's given me, I kind of pushed through life. I was always a hard worker. I always would put whatever on the line for my family. As far as, if I had 2 broken legs, I would have been at work.
Yeah.
That's what I was doing. I would have worked my side job. I'm used to working, but it's given me new life. I feel better. I look better. My clarity and thinking is better. Just an awful lot in my daily life is a lot better. Just because my cousin was gracious enough to give me one of her kidneys.
And Tanya, can you tell us if this has affected your quality of life?
Absolutely not in a negative way, but yes, in a positive way. So I'm going to answer that like lawyers answer most questions, right? It depends. But yeah, so the folks who are watching probably want to know, like, did you have to change your lifestyle? Did you have to change what you're eating? Are there things that you can't do? And so the answer to that is emphatically no. I was a healthy person before, and I admittedly had what one would call on the scale hypertension, but I was not taking medication for it because I was able to control it with nutrition, diet, exercise, and lifestyle. And so I'm happy to report after the surgery, my blood pressure is in the same range that it was before. So it's not any worse. My lifestyle is exactly the same. I already had a healthy, exercise diet routine anyway. And so that has continued. One thing that I will say that's slightly different, is that my primary care physician has asked me to take an ACE inhibitor, just because now I do have the one kidney and I did have hypertension before, but we're working together in a holistic way. So we're watching, as they say, watching the numbers to make sure that, the one kidney that I do have is not, overtaxed. But so far, there are no indications that pathologically or physiologically that anything has changed for the worse. The things that have changed for the better is that, it's given me a platform to talk about kidney transplant, kidney disease, and organ donation that I did not have before, because I'm talking firsthand. So just like we are delighted to be guests of the National Kidney Foundation here in your area, I'm doing some work in Illinois with the same foundation to raise awareness and to provide education, especially in my community where hypertension, diabetes, 2 of the comorbidities that Black Americans suffer from the most that contribute to kidney disease, know more about. And I think that I would not have had that opportunity and that platform.
The renal community is so lucky to have you both as allies and advocates. And I think that we'll look forward to any questions and answers that people in the webinar might have afterward.
Absolutely. And I'll just, as a parting comment, raise awareness in wherever you are. So talk to your family members, talk to your coworkers, share your experiences, your questions, whatever may be on your mind, because at least it will stimulate a conversation. I have the benefit of having been a part of an organization called the Lakeshore, Illinois Links chapter of Links Incorporated. And we have a wonderful initiative called Black Care, which allows us a platform to speak from about kidney disease and about chronic kidney disease and about the importance of raising awareness about transplant and being a donor. And not everybody has that, but the more that we can have these conversations in the comfort of our own living rooms, the better it will be.
Daryl, any parting thoughts on people who might be apprehensive about going through the process of being transplanted?
So I would tell anyone, make sure you get the information and then find a good care team. I was very, very fortunate to run across the SSM St. Louis hospital team. I cannot say enough about everybody, including yourself, Cody, Dr. Nazal, Dr. Randall, my transplant coordinator, Angela. The whole team they were absolutely phenomenal. And when I say a dream team, I really mean that. I appreciate from the bottom of my heart from what my cousin has done for me and what St. Louis University Hospital has done for me too. Yep. Thanks for having me.
Thank you.
Thank you. The key to finding a donor is to share your story. A key point in your story to include is an ask. What do you want people to do? Consider donating. Research kidney donation. Other ways they can help. After hearing this example, do you have some ideas about what key points you want to include in your story? You should also include some details about yourself. Why do you want a kidney transplant? What do you hope to do when you have a new kidney? What do you miss doing because you have kidney disease or are on dialysis? Another good tip is to include information about contacting your transplant center. People may be more comfortable reaching out to the hospital to ask about being evaluated as a donor, especially if they're not sure if they want to proceed yet and just want information. This communication is kept confidential between the potential donor and the living donor transplant team. We've created a worksheet to help you write your story. We've also provided several example stories in your packets. You can use these for inspiration as you write your own. A few reminders. If you're a kidney patient, you'll write about yourself. If you're a family member or friend, you'll write about the kidney patient. And you can also write about how kidney disease affects you. You can start by just jotting down ideas and thoughts. There are no right answers. No one will see your worksheet but you, so be honest. You can always make changes and decide what to share and what not to share later on. Don't think about it too much. Just write whatever comes to mind. Today or sometime in the next few days, take a few minutes to start filling out this worksheet. Once you've finished your story, it's time to spread the word. There are lots of ways you can use that story to let people know that you or your loved one needs a kidney. We're going to talk about how to share your story now. We've talked with many kidney patients and family members. Here are some ideas they've shared. Talk to family and friends. When you get together, phone calls, virtual social events, reunions, send an email or letter to people you know. Post on social media. Facebook, Instagram, Twitter, TikTok. Host a virtual social gathering to talk about the need and ask people to help spread the word. Even if they can't donate themselves, they can help by telling others. Speak at a virtual community group, places of worship, clubs, hobbies, your volunteer group. Approach groups and community leaders ahead of time. Include a photo whenever you can. Make it personal and also include some facts about donation. What about you? Have you seen any good examples of someone sharing their story? What ideas do you have to add? Share your ideas in the chat. So I'm joined by Wes and Eric. Eric donated his kidney to his longtime friend Wes, and they're here to share their story. So Wes, tell us a little bit about your connection with your friend Eric.
Well, we go pretty far back, actually. It's been nearly 50 years. Sometime this year it will be 50 years, as a matter of fact. so we met in high school, freshman year, and just became good, close friends, you know.
How did you learn that you had kidney disease?
I got really sick in 2015, unrelated to any of this, and they determined then that when I was having a lot of problems, that they were worried about my organs starting to shut down. They said that I may have future problems with organs, kidneys mainly, and so my doctor kept a real close eye on the creatinine, and just to make sure everything was functioning. Everything was good for 5 years or so, and then all of a sudden creatinine started to go up fast, and
So you went to your nephrologist and they let you know that it was time for a transplant?
that was my primary doctor, and he referred me to a nephrologist, and then he did some more tests, and then they found out that, you know, that I had this kidney problem and was going to require eventually a transplant, but we're trying to stay off of dialysis as long as we could, of course, and it got to the point where it had to be. So
It must have been a shock for you.
it was a shock, and you know, anytime something like that, it's life changing, because now you're a dialysis patient. You can't go anywhere for vacations or anything like that, because every other day you got to be at dialysis. So yeah, it was life changing.
So did you share with your friend that you were having to do dialysis?
So yeah, so of course, you know, he knew when I started dialysis and all that, and then we were talking one day, and I said, well, they have encouraged me to start this program to see if I was a recipient for a kidney, or a candidate to be a recipient. And so he said, well, when you find out if you're a candidate, I want to be tested. And I mean, that was a lot. And so we talked then too about, I think you better speak to your wife, and I think you better speak to your older brother and his wife, because, you know, his older brother has some health issues and in the past. And so he said, I already have talked to them, and they all said to go. So
And so his decision to be tested, how did that make you feel?
I was happy, to say the least, and also a little reserved, because, like I say, I would find it very difficult to ask someone, but to have someone volunteer is a lot, and so. And then when he called, after he had gone through all of his testing, then he called and said, we're a match.
So let's back up a little bit, Eric.
Sure.
Tell us more about the first time that you called SSM, St. Louis University Hospital.
Well, I think through Wes, he'd given me contact information. I guess it was you at my first call. You know, at that time, I didn't even know what the process was, what it was going to be like to give a kidney, whether I'd be a donor. So just picked up the phone, and we kind of walked through all the criteria, found out I needed to lose a little weight to be eligible. So we went through that process. You know, the process of donating for me was really never a question in my mind, other than are we compatible? So set up a date to come down and have them take a few vials of blood and do all of the tests, lots of tests, to make sure that my health history and my blood type and all that matched up. And we got really lucky. I was really happy to hear that.
If for some reason you were turned down, what would your reaction have been?
I would have been extremely disappointed, but at least then I knew that I had given it the opportunity. If it wouldn't have been my fault if I was turned down, if it wasn't a match. So got to give it a try.
That's right.
Yep.
Did you learn a lot about transplantation by going through the process?
Yeah, I mean, obviously, you know, we sat down, we reviewed what the process was for myself, what it was for Wes, you know, all the different things. And obviously it is a major surgery for the recipient and the donor. So what the risks are. And to me, it was a no-brainer.
Do you think it was worthwhile for both of you to go through this?
I'll go first.
Okay.
Absolutely. Right. Obviously, like I said, it's a major surgery, so there's discomfort involved, but not a big deal. I mean, it's a big deal, but I was very comfortable with the whole process. So, absolutely do it again. Unfortunately, I can't do it again because I only got one left. But I would do it again if I had another kidney to give.
Our evaluation of Eric was very thorough, and we wanted to make sure that you would do well before we proceeded. Any reservations about going through with it?
No, like he said, it was a major surgery, and there's a lot of adjusting to do on the recipient's part because they got to get medication adjusted properly, and there's just a lot of things. And then there's a foreign object in you that your system doesn't recognize, and so there's some. It's not all easy and all that. I spent a couple different times after the transplant in the hospital, and and most of that was adjusting things again, but going through everything, it's absolutely all worth it at the end. I mean, because you're a free person again, as far as not having to go to dialysis, and you can enjoy your. In my case, in your case, we can enjoy our retirement now, where I really wasn't looking forward to retiring, having to be on dialysis.
So what would you say to someone who's struggling on dialysis that's having a hard time sharing their story?
Well, sharing the story is very important because that's what brings out people that want to donate to start thinking about the donation process. So, just talk to as many people as you can and tell them what you need, what you're going through, and what you'd like to do, and you can do all that and not ask directly, someone. You don't even have to ask family members. So most of the time, I think a family member would volunteer to get tested and see if they're a donor. So that's what.
And Eric, do you have any advice on people who might be considering coming forward as a potential donor?
It doesn't hurt to find out the connection to whoever, the nephrologist or whoever, to find out if you are a candidate. Obviously, the first match was blood type, and after that, some other testing. There's really, other than a little bit of your time, there's nothing in that process. And they were very good about letting me know that I didn't have to go forward with it at any time. I could change my mind as they explained all the details. And that was kept in confidence between us, and that worked out well. It was never a question for me, but if for somebody else that wasn't sure, there's no commitment going on into that process. You have time to make up your mind.
And an important point here too is that the recipient's insurance takes care of all of it for your donor as well as you. Yeah. So, if a donor is worried about the cost of it or the insurance portion of it, the recipient's insurance covers all of it. So
yeah, that's absolutely right. We cover the medical evaluation, and then also we can apply for grants through the National Living Donor Assistance Center to cover lost wages, travel expenses.
Yeah, so really, there's nothing out of pocket for the donor. The only thing he has to feel comfortable with, he or she, is that they're comfortable with going through the operation.
Now we're going to talk about Strategy 5 to build a network of advocates. Your network of advocates are the people on your team who are here to help and support you. You don't have to do this alone. Think of all the connections and relationships that you, your friends, your loved ones, and family have. Where would you feel comfortable sharing your story? In your packet, we've included this handout, which we call your circles of influence. These are people who you might be connected to, who might be able to help you. These people can consider donating a kidney, but they can also help you carry out strategies and spread the word, or just provide you with moral support at the time you need it most. Think about who can help you. All of these ideas might not apply to you, but hopefully some of them do. Do you work? If so, where? Does your employer or your coworkers have a newsletter or a bulletin board? Do you have coworkers that you are close to or that you would feel comfortable sharing your story with so that they can share it to people they know? Do you volunteer? You can find out if community groups that you belong with have a newsletter or bulletin. Even if you don't belong to any places of worship or community groups or organizations, maybe your friends and family do, and they would be able to help you spread the word in that place. The more your story is shared, the greater your chances are of having a living donor step forward. What connections on this list stick out to you? Any individuals or groups that we're missing on the sheet? Where do you plan on or feel comfortable sharing your story? Please share your thoughts in the chat. Now, donors often ask us about the costs of donating. Remember, the evaluation and the hospitalization costs are covered by the insurance. However, some costs, such as travel to and from the transplant center, are not covered by insurance. Donation should not be a hardship for the donor, and we're very invested in making donation a cost-neutral thing for the donor. And so the NLDAC, or the National Living Donor Assistance Center, can cover the cost of travel, flight, rental car, gas for the donor, and for the caregiver, who's an important part of the process. They can also cover lodging and meals during evaluation and before and after surgery. This assistance is dependent on the recipient's income, and a transplant social worker has to apply for you. It will also cover multiple living donors going through evaluation, not just the one who ends up donating. If you check to see that your household income qualifies before you write your story, you can include that all of the expenses will be covered for them, which will help you and your potential donor feel more comfortable about the process. Here are some additional financial resources to help living donors. You can ask your transplant social worker for more information. American Transplant Foundation offers financial assistance such as lost wages for recovery and for donor education. American Living Organ Donor Network helps living donors with the financial costs of donating, such as loss of wages during recovery, flights for evaluation, and for surgery. It also provides mentors and fundraising assistance for donors, since the financial aspects aren't the only ones that can become a hardship. National Foundation for Transplants helps both donors and recipients financially throughout the transplant experience by providing fundraising assistance.
A potential living donor must contact the transplant center to be evaluated. The recipient cannot contact the transplant center on behalf of the donor. It's a good idea to have the transplant center contact information shared with your story. This will help potential donors know what to do, as they might not feel comfortable contacting you until they've been evaluated or may want to learn more information. Have interested donor candidates visit www.livingdonorsluh.org. You can also explore the UNOS, National Kidney Foundation, and National Living Donor Assistance Center websites for additional tools.
The National Kidney Foundation is here to help you after the webinar. We want to continue to support you, and there are lots of ways that we can help. We have a toll-free helpline called NKF Cares that has trained professionals who can help you. They can answer questions that you may have and send you free brochures and other information. Your packet also has information about NKF Peers, our peer mentoring program. You can call or email us, and one of our social workers will talk with you and find the right person for you to talk to. You can be connected one-on-one with a patient or living donor for support, to ask questions, and hear from someone who's been there. You can also connect with other kidney patients, transplant recipients, or living donors online through NKF's online communities. You can remain anonymous if you wish and get answers and support from other patients, caregivers, and living donors in an online forum monitored by the National Kidney Foundation. NKF's website on living donation has lots of information for you. This website is part of an extensive multimedia campaign designed to raise awareness about living donation and transplantation. You can also help by being an advocate for living donation. By joining thousands of other kidney patients, family members, and living donors, you'll have the chance to make a difference by helping to improve or change what's important in the lives of kidney patients nationwide. Visit advocacy.kidney.org to make a difference. We're almost done. The final step in our strategies is to write your action plan. This is a picture of the action plan you have in your handouts. These strategies only work if you use them. We've included an action plan handout in your packet. While it's fresh in your mind as soon as this webinar is done, we recommend you take some time to jot down your ideas for your action plan. What are you going to do this week or month to start? Maybe you just want to start working on your story, or maybe your story is done and you're already starting to share it. Can you share more on Facebook, TikTok, send a letter, create a flyer, host an event? Can you contact the National Kidney Foundation for help? Can you ask other people to join you in advocating to find a living donor? That's it. You've now learned the 7 key strategies to find a living donor. Now you have the tools and resources that you will need to get started at home. It is now time for our Q&A portion in which our panelists will answer your questions from today's program. Please feel free to continue to type any new questions into the chat box. But before we begin this portion, I want to thank you for joining us today, and of course thank you to SSM Health St. Louis University Hospital team. We want to continue to offer this program to kidney patients and families around the country, and your feedback really helps us to improve the education that we provide to kidney patients and their families. We will be sharing a link to our brief online evaluation in the chat box, as well as via email following this program. Please take some time to fill it out and let us know what you think about this webinar. Thank you again for your precious time spent joining us today.